All right, now there we go, ladies and gentlemen, happening right here. This is, once again, let's put your hands together and make some noise, all right, for the Focus Point Worldside Day Roadshow, proudly presents to you by Focus Point and partnering as well with Zeiss. Now, ladies and gentlemen, we have heard on myopia just now, and next up, ladies and gentlemen, to present on the next eye health topic. Eye examination should go beyond power check. Ladies and gentlemen, once again, please join me in welcoming our Professional Services Manager of Focus Point Vision Care Group. Let's put your hands together for Ms Chia Jho Yan.
Okay. Thank you very much for the kind introduction. I'm Chia. I'm the Professional Services Manager and also Head of Training and Development of Focus Point Vision Care Group. So today, I will be talking about why eye examination should go beyond power check. Basically, I'm going to explain why we are putting you through so many stations here at Mid Valley Mega Mall this week. So this is my profile. So I have about 15 years experience in the industry. I've spent about 7 years in the optical retail and the balance 8 years in teaching and training. So I've taught lectured in Sagi University, UCSI University. I've done training for Bosch and Lomb, Malaysia. And also I've been quite active with the Association of Malaysian Optometrists as their secretary, as their newsletter editor, as their organizing chairperson for seminars. So before joining Focus Point, I also spent about 2 years training with another optical group called Bolton. So that's a smaller group, about 50 outlets. So I've been with Focus Point for about 1.5 years so far. So we are going to talk about 360-degree advanced primary eye care today. So before I go into this slide, let's talk about the history. Advanced primary eye care started in 2018 December. At that time, we started with 20 outlets. It was a very humble beginning, so we chose some prime outlets to start off with the campaign. So earlier this year, in February, we actually relaunched this thing. We launched it and we rebranded it. Why did we do this? We do this because there was a poorer awareness towards the services that we are providing. We have extended services, but the public is not aware that we are actually providing the services. So that's why we decide to rebrand and launch it again in a bigger roadshow, so that the public will be aware that, you know, this is what we are offering and this is not something new. We actually offer this since 2018. So the 8 steps we have is eye health history. So we will actually go through your history, like how long have you been wearing glasses? Are you short-sighted, long-sighted, astigmatic, or presbyopic? Then we will also go through like, do you have any like diabetes, you know? Then we need to find for those possible conditions in the eye. Do you have family history of glaucoma? Do you have family history of age-related macular degeneration? Those kind of things. So we will actually find out more about your personal background. So, and the second will be color vision test. So color vision test, we will test, this is a standard test. We will test on everyone that comes for 360-degree APEC in the outlet. We don't do it in this roadshow because too many stations, you have to wait very long. So the color vision chart can be found in the optical store. So normally, the normal people that appear colorblind is the boys normally. So we also go through binocular vision test. This is very important because a lot of people tend to have migraine headache. Actually, it's due to binocular vision. There's some problem with the muscles. Then next, we will check the common refractive error. So check your power. So that's what you do every day in the optical outlet now. Then we will look at eye surface or anterior surface assessment. So this is actually to check for cataract, dry eye, any blockage of your tear glands. And we will do an eye power check. Eye power check is basically to screen for high eye pressure, which is higher risk for glaucoma, 青光眼. Then we will do a retinal screening. So we are looking for glaucoma, diabetic retinopathy, hypertension retinopathy, myopic maculopathy, age-related macular degeneration, so certain diseases that can happen in your retina. And lastly, we will conclude everything and do a consultation session. So this is the basic steps that we go through. So this is actually a video. It's actually our 360-degree video. So 360-degree APEC video, it actually explains each step. So we actually have our training manager, Zarif, as our brand ambassador. So this is the color vision test with the Ishihara chart. Binocular vision assessment. Refractive error check, power check. This is your slit lamp anterior eye assessment. Up next is the eye pressure, the glaucoma screening test. So then this is a retinal screening, number 7. Lastly, it's a consultation session. Basically, it's a summary of all the tests. So we actually have about more than 70 outlets with the full set of equipment. So Focus Point is very sincere in providing quality eye care and eye services. So why I don't give you the exact number like 75? Reason is because we actually have a few outlets that has signed up for the program but still waiting for the instrument. So we are in the midst of ordering the instruments. That's why it's like more than 70 but inconclusive like 74 or 75. So I'm going to show you some real-life cases. Why? Because I think it's more, it shows you clearer and it's more, generally it shows you clearer how APEC 360 can help you to detect beyond, diseases that is beyond your refractive error, beyond myopia or astigmatism. The first case is a 60-year-old man complaining of monocular diplopia. Monocular diplopia is if you cover one eye, you see double, meaning one of the eyes is seeing double. So it's actually very uncommon. The reason is because normally when we see double vision, you cover one eye, it disappears. Because the most common cause of double vision is actually binocular vision problem. So this old man has a monocular diplopia, which is double vision in one eye, that is still there when you cover one eye. So he's quite old, he's 60 years old, he's Chinese. So he complained on the left eye is having monocular diplopia. So this is slow. It's not something that happens suddenly. Today I go to sleep, tomorrow I wake up and it becomes double. So it's like slowly growing and it's like maybe 6 months suddenly it appears one day. So, so it's more disturbing in the previous 6 months. So we check the power, there's not much change. So we try to correct the power and it still remained there. So this is how it looks like. If you can actually see in the picture, there's a white line, white color line in the middle. It's actually a cataract. So this person have a cataract that looks like that. It's called a cortical cataract. So without the slit lamp, which is the anterior eye assessment, you will not be able to detect this condition. So you need the slit lamp to visualize, to clearly see the cataract. So this is first case. Second case is monocular blurring. So this is also an old person, old lady, 68-year-old Malay female. So she has been diabetic for more than 20 years on medication. She claimed that control is good. So she complained one eye very poor vision, see not clear. I give the full power, also she's seeing 6/12, meaning she's losing bottom 4 lines. So she's seeing the 5th line. So she also failed color vision tests. So, and she hasn't checked her eyes before in any eye clinic. She only went to optical store. But this store is the first store that actually helped her to check more. We actually had an OCT and a fundus camera. So we actually found that through color vision test failed, fundus camera, some abnormalities, some yellowish some abnormality on the macular area, and through OCT we can actually see some edema. Is diabetic macular edema. It's a swelling. So it can happen when you have diabetes and the control may be not so good. So this can happen. So this is a second condition where the retinal screening or anything more than the refraction can actually show you what it is, because like the color vision also fail. So it actually tells us the macula is something wrong. So it's accumulation of fluid. So this is 6.8% of diabetic will actually have this problem. So the you can actually use fluorescein angiography guided laser. The doctor will do this procedure, and also anti-VEGF. So this is a kind of jab into the eye. So this is a white bump on the cornea. So this lady, she's not exactly complaining. She's a 36-year-old contact lens wearer, a soft contact lens wearer. So she said left eye is a little bit disturbing, like got something there. So she wear contact lens for long hours, 12 to 16 hours a day. So she actually had very good vision. When we check refraction, the vision is very good. She can see 20/20 or 6/6. So, but when we check her eye, we found that, you know, there is actually a bump on the cornea. So hers was right underneath the lid. So we couldn't, this is a sample picture, but hers was right underneath the lid area on the top at 12 o'clock position. So we couldn't see the redness surrounding the lesion, the abnormal formation. So it's actually not a corneal ulcer, not a corneal infection, but it's an inflammation reaction to bacteria. The lens is not cleaned properly. So we refer her to the doctor. Do you have a question? You look like you want to ask something. Okay, so it's a corneal flectanulosis. So it's an inflammation of the cornea. It's due to this bacteria called Staphylococcus. So it's a very common bacteria. So the treatment is some steroids. So yeah. Next is a silent thief of sight. This is a very common name for glaucoma. So this is how it looks like. That is A is normal, B is abnormal. We can actually see that the brighter area in the middle is much bigger in the second picture. So this is a glaucomatous cupping. This is a 1 ratio. So this is a very, very advanced glaucoma. So this is a 45-year-old Indian man with family history of glaucoma. Glaucoma is something that runs in the family. So he came to the optometry practice. There was no complaints. So the eye pressure is normal at 18. So he's also not complaining of tripping, because glaucoma, you get tunnel vision. Sometimes you cannot see the things on the side. You will trip. Maybe you accidentally kick a chair or something. So he's not complaining. So, but how do we look for glaucoma? We look for the cup, the bright area in the middle, the cup enlargement. We look for any bleeding around the disc area, any thinning of the neuroretinal rim. This one, the optometrist will show you where it is. You don't, and also any asymmetric cupping, meaning one cup small, one cup big, and loss of nerve fiber layer. This is how loss of nerve fiber layers looks like. You can see slight different color at where the arrow is. Blood vessels, they tend to go to nasal, near to your nose. So it's actually this one, the paler disc. And here you can see that the disc on this side is a bit paler, not so reddish, not so orangey. So the glaucoma disc will be like that. So the next case will be a monocular ocular discomfort. So the eye is not comfortable in a 42-year-old Chinese female. She's also a contact lens wearer. This one is a contact lens abuser. She sometimes accidentally sleeps with the lens. So she's wearing Air Optics multifocal. So she's someone who really loves her contact lens. She seldom wears glasses. So she said one eye is discomfort. So she came into the eye clinic with her contact lenses. So we actually removed her contact lenses and did a fluorescein staining. So we can actually see with the slit lamp that there's like a cut on her cornea. It's a abrasion. So we can see, but it's very superficial. We can use the slit lamp to see how deep is the cut. So this one is very superficial. So because it's very superficial, we asked her to stop wearing contact lenses. But in this case, she was not lucky. After going home, she continued wearing her contact lenses and she ended up with an infection. She got a fungal infection. So in this case, I felt that on our side, what we could have done better is we could have asked her to go to the doctor immediately, because at that time, we thought that it's very superficial. So it's a mild scratch. So it can actually heal within 3-4 days. So we asked her to go back and stop wearing the lens. But she actually continued wearing the lens. And maybe the lens is not cleaned properly. She ended up with an infection. So I think we could have given her a more stern warning and we could have prevented her infection. So abrasion and laceration, basically, laceration is deeper. Sometimes it will cut all through the cornea. You may need a stitch. And sometimes you also need a surgery. So abrasion is more superficial. Hers is an abrasion. So the next case is reduced contact lens wearing time. So this girl, she actually bought a very good lens. We tell her, oh, you can actually wear for more than 12 hours. This is a very good lens. But she came back complaining because she can wear for less than 8 hours. So there's something wrong with the eye. So she's 24 years old, quite young, not old enough to have dry eye. So we actually put her through the slit lamp examination and we see this. You can actually see some bright green spots at the bottom. She actually has corneal staining. It's actually due to dry eye, possibly incomplete blinking. So this is something that the slit lamp or anterior eye assessment can see. So if you don't have the slit lamp in your outlet, you cannot even detect all these conditions. So she also has very low TBUT. TBUT is the tear breakup time. Very dry eyes generally. So you can also see with the slit lamp. She also has all these bumps along the lid margin. It's where your tear gland is. So it's blocked. So she actually has meibomian gland dysfunction. It looks like this underneath the lid. This is a meibography. So they normally use this for research. So what this does is it actually helps you visualize your meibomian gland using infrared light. So you can actually see that there is like crooked, not straight meibomian gland. This is your tear gland. So this is how it looks like. So it's sometimes shortened, dilated, and it's also, some of the cells also die, so you don't have glands. So meibomian gland dysfunction can lead to all this, and with the slit lamp, you can actually detect meibomian gland dysfunction. So in conclusion, eye checkup should not be limited to refraction or power check, because there are a lot of conditions that can cause a simple blur vision, or like monocular diplopia, which we saw just now. So eye care services should extend beyond power check, because like diabetes, at point of diagnosis, you should be seeing the optometrist to do your annual retinal check already. So we need to take a more comprehensive approach. So focus point here feels that 360-degree APEC, advanced primary eye care, should be the direction for eye care in Malaysia. It should be a benchmark, and the reason will be the eye is much more complicated than just the power. So improve our vision is a journey worth taking one step at a time. This is a message from Focus Point. So do make an appointment. See our 195 optometrists. We have the most optometrists among the chain stores in Malaysia. So make an appointment, see your Focus Point optometrist today. So this is from last year's World Sight Day. So with that, I thank you for your attention. Any questions from the floor or from MC?
Ms. Chia, that's one reason why I have the question look since just now. You know, after seeing all the cases and everything, one thing actually came into my mind. When should we actually go for all this more deep and more further checkup?
I think it's compulsory if you're 40 and above. Yeah, that's
when you actually grow older,
yeah,
then
compulsory.
It's compulsory.
Yes. If you are a normal person out of the 40 years age, you can do it once a year, once 2 years, when you change your glasses. But if you're above 40, you have to do it every year.
Yeah. every year. So the
Yes.
recommendation here is every year.
Yeah, every year for above 40, and if you are below 40, then maybe once in 1, 2, or 3 years, depend on when you change your glasses. Because the diseases tend to come in after 40. If you are a contact lens wearer, recommended to do a 6-month check before you replenish your contact lens.
But can I say that I'm not wearing any glasses and I don't really have any vision problems, not 老花, like what Mr. Paul said just now. So,
Yeah.
does that actually means that I can?
You can just do it once and maybe repeat it after 2, 3 years. Yeah.
So
the ones will be just to have a guideline, a baseline to know what is your current eye status. Yeah.
So I think Focus Point right here is doing a very great job bringing all this technology here. So Malaysian especially, because since, I mean, growing up, we actually were told by our parents or even our friends, the elders, that, okay, you should do checkup, blood tests, all those, but no one actually mentioned on very deep eye check. So that's very
comprehensive eye check.
Yeah.
Yeah.
All right.
So like in your blood test is once a year. Your dental check is once every 6 months.
True.
Your eye test is once every year as well.
Yeah. So that's the very important message here to let everyone here, especially at Mid Valley. It's your lucky day today because you actually get to know this. This is my first time actually knowing this, because before all these symptoms happen, like what we saw in the case, all the cases just now. So it's better if we actually do the comprehensive eye check to prevent all this to happen, and to actually, maybe we can still cure it before it actually go.
Prevention is better than cure, and early detection saves a lot of vision. Yeah.
That's the main thing here. Yeah. Okay, so I'll open the floor once again. Any one of you right here, if you have any questions on
from the floor?
Eye check. Yeah, on eye check. Like, eye check, I mean, something very common comes to our mind is the machine that we actually see usually in any eyeglasses shops, but this is definitely something very important to do.
Yeah, and we are also bringing in artificial intelligence technology. So it's something new. We started in August. So this will be rolled out in the coming 6 months to all our advanced primary eye care outlets. So it's a retinal screening that gives you a 6-page report. So we are also starting that. So that will be charged at 120 ringgit.
And that's quite user-friendly, I think, with the price.
It's a very simple process. 5 minutes, you will get the report already. Yeah, so it's a new technology from China. So that's something new that Focus Point is bringing in to improve our eye care services.
All right, there we go, ladies and gentlemen. So for more information, make sure that you visit Focus Point, all right, for comprehensive eye check. Okay, so I believe that we don't have any question anymore right here from the floor. Ms. Chia right here has explained very, very detailed, so everyone actually understand a lot. Okay, so there we go once again, ladies and gentlemen. Special thanks to our professional services manager of Focus Point Vision Care Group. Once again, let's put your hands together for Ms. Chia Jho Yan.
Thank you for your attention. Thank you.
All right, and ladies and gentlemen, there we go. And make sure that you stay tuned with us right here, because as mentioned by Ms. Chia just now, we have all the comprehensive eye check right here as well. So make sure that you visit all the booths available and do the health check, do your eye health check with us as well. All right, once again, special thanks, and I'll see you very soon. Thank you.
Thank you.